And we're back, and we got the 11 o'clock hour, and we went from Mike Gallagher to the anchor. This is Dr. Gideon Orbach, the man who's been anchoring the Wellness Center here for the last 14 years with his wisdom, dedication, and energy. And of course, his workshops are always different than everybody else's. They require your participation most of the time. Even if you don't participate now, you will at some point, right, Doc?
Yeah.
All right. So without further ado, Dr. Gideon Orbach, everybody. Tell everybody how to work from home, will you, Doc? Because more people are these days.
Yeah, for real.
All
right. Well, first of all, before I begin talking about anything, big shout out for the lean greens, one of my favorite drinks. It's alkalinizing, mineralizing, tastes like apple cinnamon, and right now, most importantly, it helps prevent your voice from getting parched. Joe, thank you for that warm introduction. My name is Gideon Orbach. I've been practicing chiropractic here at the Weiner Wellness Center. Well, actually, it started off as a pain release center. We were in a building that did not have a lot of space or a lot of parking, but it had character coming out of every pore, if a building can have pores, on the south side. We moved here to this Green Tree campus in October of 2008, and we were renamed the Weiner Wellness Center. And most recently, in February of this year, Jamie Dorley took over, and we renamed ourselves the World of Wellness. So it's been the same place all along, just names change, ideas, they get better and better, services get better and better, but it's still the same physical location and the same gist of it. So I got to tell you guys, I'm a little undecided. I feel powerful today because I'm wearing my official Sarah Shook haircut. I spoke on Tuesday, and Dr. Tracy Straub, who was moderating online and on the computer, gave me a little aggravation because it's the first time anybody's seen me put product in my hair because it was just so long and out of control and too heavy to carry around. And I got a haircut, so I feel powerful. Sarah did a great job. Second of all, for the people who've been listening to me lecture and workshop and paying attention to me for a while, you guys all know that I have this favorite tie that I wear for my workshops. And I've been wearing that same favorite tie for workshops for a lot longer than I've been practicing chiropractic, which is 20 years. And ties have a life expectancy. So they fray around the edges when they get old. And I just don't want to push that look. So I'm wearing a new tie. This is an open audition for new favorite ties. So we'll see. So I'm really low key about this in the sense that this is a live presentation. There's really nobody within 10 or 15 feet of me. That's why I feel very comfortable standing here without a mask. I don't want to offend anybody. I used to do these workshops like everybody else live, and the house would be packed and people would ask questions as we went along, and we'd get a little sidetracked and help some people out with some ideas along the way. And now most of that is online. It's on virtual, and I've intentionally positioned myself in such a way that I can't see the TV to distract myself. So if you have questions, or you have comments, or you feel like you want to participate in what we're going to do, feel free to include yourself in the chat box along the side of the on the side of the screen. And I know that we have the very talented Phil is moderating and taking care of things, and on the technology side. So if you have questions, comments, even more outrageous, let them fly. We'll address that. So I said, tell her, Linda, hi, thanks for signing in. So on Tuesday, the talk was about the presentation, the workshop was about what can your chiropractor do for you? And we talked about the advantages of seeing a chiropractor with a neuromusculoskeletal approach to clinical treatment. And what we want to do is we want to convey to people that what I'm doing here, what Dr. Phil is doing here, what any other chiropractors who we bring on board will be doing, is we're looking to recalibrate and repair the way your brains and your bodies are talking to each other. And we use a hybrid of techniques, and we look at total physiology, not just in total anatomy, not just the way you point to a spot that hurts and say, can you treat me for this? Well, what we're looking to do is help you with your breathing mechanics and help you with your coordination and with your balance and your athleticism and your flexibility. And we're looking to get your brain and your body to talk to each other in a fluent conversation. And along the way, the aches and the pains dissipate, and so many other body features start to improve. And that's our paradigm here. That's what we do. And I contrast that with other chiropractors out there who, you know, if you have a bone that may be out of place, they might think it's out of place. They might have assessed something to be out of place. Let's just adjust it, try and put it back into place, and hope that that solves your pain. And we find ourselves going for treatment 3-4 times a week for months at a time and not really experiencing tremendous benefit. Whereas with the paradigm that we practice with, we see people once, we see people twice, and you know, maybe their problems aren't resolved, but they feel like they're already on their way. On Tuesday, we also talked about the parasympathetic nervous system and the sympathetic nervous system, which together make up the autonomic or the non-voluntary nervous system. And we talked about how we can use techniques and maneuvers and exercises and principles to stimulate one and inhibit the other when the time is appropriate. And we talked about pressure-sensitive joint mechanoreceptors and what role they play in your neurological health and how your brain and your body are communicating with each other. And we talked about feet and how important it is to adjust people's feet from both a local manifestation as well as how by adjusting people's feet and taking care of all those joints, it plays such an important and crucial role in somebody's overall health and overall musculoskeletal presentation. So we spent some quality time talking about just the academic things that a chiropractor should know, as well as the practical, technical things that a chiropractor should know in order to be able to help you as comprehensively as possible. So in a sense, what we covered on Tuesday was what can your chiropractor do for you? How can your chiropractor help you? But today's going to be a little bit different. Today, what we're going to talk about is what can you do for yourself? What can your chiropractor show you how to do or guide you to do so that you have some empowerment and some new self-awareness and a new understanding of exercises and drills and postures and just life events and physical events that you can do on your own that will enhance everything and support everything that we're doing here. So what I'd like to do first of all is let's look at this way. Let's look at your body as being a giant antenna. And your antenna is constantly receiving, transmitting information back and forth between the environment and the brain. So what we want to do is we want to optimize this antenna and make it as efficient and as effective as humanly possible. And two of the things that you can do to really help your antenna or position your antenna in a way that you're going to be physically healthy and you're going to be able to receive and transmit as much information from the environment to your brain and back from your brain to the environment as possible, is we want to talk about our posture, how we're going to point our antenna, and deep breathing, how we're going to stimulate that antenna. So let's do this. Let's talk about posture for the start. And when I want to think about standing as straight and tall and as efficiently and effectively as possible, I'm going to first think about this area right here at my belt buckle. And then I'm going to come to the spot where I'm at the bottom of my chest and I have that area where I'm at the top of my abdomen. So if I push up here, it's muscle tissue a little bit lower, and I feel that a little bit lower, I mean maybe half an inch lower, I feel the hard bone that makes up the bottom of my rib cage as it forms this arch above my abdomen. And then as I get another half an inch lower, I feel that really tender piece of cartilage called the solar plexus, the xiphoid process. And then a fraction of an inch lower, I feel the fleshy part of my abdomen. So we're talking about belt buckle to a piece of anatomy that's maybe 2 inches big right here at the center. And what I want to do is I want to make myself as tall and as long as possible in this area. So I'm lifting and stretching my abdomen. And when I do that, I feel my shoulders falling backwards or rolling backwards into a really comfortable position. And I'm going to take my shoulder blades, my wing bones, my scapula, And I'm going to very gently squeeze them together. But more importantly, I'm going to try and point them down towards my belt. So here I am feeling very long in the abdomen. I'm feeling like, because I've become tall here, my pelvis or my hips have shifted ever so slightly forward. My shoulders are back. And what I'm going to do with my head is I'm going to imagine that there's a piece of string coming down from the ceiling, attaching to the point of my head where I'm the absolute tallest at the very top. And the ceiling is pulling on that string, just kind of lifting me up. So now I'm standing pretty straight and tall, but my body is in really good biomechanical alignment, and I'm using my body to be able to support itself rather than if I kick my one leg out far enough to the side and I lean into it, or if I rotate my torso or I bend over a little bit too far forward, and all of a sudden very specific muscles that are capable of doing this but don't have to are going to end up supporting myself rather than using my skeleton and my muscle system to work together to support my torso. So I'm just working on standing here, standing practice standing. And if I decide to sit down, I'm going to sit in the exact same way as I'm standing, in the sense that my torso, my bottom part of my torso, my abdomen is going to be long and tall. My shoulders are still back. My head is still up. I've just transferred myself to a sitting position instead of a standing position. So this is the way we're going to put our antennas in a very relaxed, comfortable, efficient, and effective position. The next thing we're going to do from this well-balanced standing posture, we're going to start working on our deep breathing technique. And what we're going to do is we're going to inhale through our nose, and we're going to feel our torsos and our abdomens expanding with the delicious oxygen that we're sucking in. At the same time, our shoulders are just sinking further and further back, not elevating or shrugging to create space up here. Rather, we want to put the breath into our abdomen. So everybody, big deep breath in through your nose, the deepest breath that you possibly can. Here's my torso expanding to accommodate all the oxygen coming in, and I'm going to hold it for 1,001, 1,002, 1,003, and I'm going to relax and blow it out through my mouth. And I'm going to return my body to the position it was between breaths. Okay, one more time. Big deep breath in through your nose. Everything is expanding. You feel your abdomen filling, your chest filling like giant balloons. Your head is still up. We're not falling forward. We're going to hold for another 1,001, 1,002, and blow out through your mouths. Now, just to illustrate how easy this is relative to what breathing is like in poor posture, everybody who's playing along and participating with me, and I hope that's everybody listening in from all four corners of the internet universe. Let's do this. Let's distort what we've done and think about what does your head do when you're driving, or when you're leaning into your computer monitor, or you're leaning into your food and you come into this is called anterior head carriage. We're carrying our head further forward, and anterior is forward. Carriage is the way we carry ourselves. So let's go to this pathomechanical, bad biomechanics position. And if you take a big deep breath in with your head held forward, you should find that it's almost blocked, that you can't breathe as deeply as you could in good posture. Now, this is a fantastic, fantastic nutrition store. We have products that support every organ, every part of your body. We want to strengthen your immune system and fortify your immune system. There are dozens, literally dozens of products that you can choose from that we have on our shelves here. If you're interested in having a high quality protein supplement, if you're looking for high quality anti-inflammatories or fish oil, we have it. This is an excellent nutrition store. But I'm going to suggest to you that if you're not breathing efficiently and you feel yourself starved for oxygen, you're going to fatigue so much faster. All of your metabolic processes, your liver function, your heartbeat, your digestion, your ability to regulate your sleep, your you name it, we're going to be at a disadvantage, and we're going to have physical problems simply by not getting enough oxygen into your bodies. And all the nutrition in the world is not going to help you until you become a better, more efficient breather. That's how important this is. So that being said, let's do this one more time. Long, long, long in the abdomen. Shoulders are back. Head is up. Deep breath in through your nose. We're holding 1,001, 1,002, and blow out through your mouths. Okay. So with everything that's going on in the world, I'm not going to get into geopolitical global health. I think everybody who's listening in knows which pathway we can go down, and it's just too long of a story, and I want to stick to my matter at hand here. Work has forever changed. So many people have been reassigned or have been given the opportunity or been forced to start working from home. I think there's data out there to support that so many major corporations and businesses have found out that it's just more economical to let people work or to have people work from home than to pay for a commercial workspace. And here we all are. Once upon a time, we were in an office or a cubicle or just a facility with coworkers and a support staff and a social network physically present. And now all of a sudden we're cast off and told to work at home and be as productive as we once were, if not more so. So the word ergonomics. Ergonomics literally means the study of efficiency at the workplace. So what we want to do is if we're working in an office or working at home, either way, we want to be as ergonomic efficient as possible, and we want to be able to be as comfortable. We want to be able to have a way to use our bodies as successful antennas, whether we're at home or whether we're at the office. So these rules certainly apply everywhere. But once upon a time at the workplace, there are people who help you design your desk, your workstation, what have you. And now we got to figure out how to do this on our own. So what we want to do is, how do we create a good, ideal, comfortable, pleasant home workspace? And what I've done is, I mean, some of these are my ideas. Some of these are ideas that I've gotten from other chiropractors that I network. Some of these actually came from some of my patients who told me what they were up to and what they were doing. So we have a quick tip list. We're going to run down 10 or 15 different bullet points of what can you do to enhance your ergonomics at your home workstation. So first of all, when you slouch, when you're sitting in a position that, unlike the complete opposite of the one that I'm describing, is we want to be long in our torsos, tall in our abdomens. So if you find yourself slinking into here, there are two things that come to mind that we have to talk about. One is, from a chiropractic perspective, one of the most popular and common sets of symptoms and conditions that I treat relates to what's called a hiatal hernia, which is where your stomach, literally your stomach has gotten itself caught in a ring-like or a valve musculature, or even pushed or herniated its way all the way up into the diaphragm muscle, which leads to a number of very uncomfortable and painful symptoms, including heartburn and acid reflux, including being short of breath and having a constant cough, trying to equalize the pressure in your chest cavity, because the stomach is now no longer able to move or to vibrate the way it is supposed to. So from a clinical perspective, what we do is we make adjustments to the stomach to get it uncaught from the anatomical structure that it's been trapped by. So if you're sitting in a position where you're slouching and slumping in from a prolonged time, this could pretty much be considered an etiology of the hiatal hernia condition. Number two, well, actually, before I move on to number two, like I said, this is a very common condition. It's one of the most, if not the most common thing that we treat here. If you believe that you're suffering from heartburn, acid reflux, if you've been diagnosed with a hiatal hernia, if you wake up with a metallic taste in your mouth, if you feel food getting caught in your chest and you have difficulty swallowing, I'll bet you I see at least one of those patients every single day. So there could be hope for you. The second thing that I want to highlight about sitting all day long is when we sit, depending on the posture that we're sitting in, we're adding anywhere between 40 to 90% increased load on the discs of our lumbar spine. So let's talk about the economy of back pain. I'm sure that everybody listening in knows of somebody who's had or has been a candidate for back surgery because they've had disc herniations which interfere with their normal activities of daily living. Look, I'm not saying back surgery should never be performed. I'm not opposed to, I don't have a fight with the orthopedic surgeons. I don't have a fight with the neurosurgeons out there. I'm just saying that there's so much that can be done preventatively before we even have to have this conversation. Once people start to have conditions relating to disc herniations in their lower back, there's still things that we can do to help. Don't let these symptoms run away with themselves and take on a life of their own. Don't let this go unaddressed. So if you find yourself sitting all day long, increase of pressure load on your spinal discs in the lumbar spine, particularly of 40 to 90%, and that leads to a loss of work, a loss of productivity, certainly the mindset of somebody who is in terrible pain. It could potentially lead to very expensive and debilitating surgeries. It could lead to long, drawn-out, painful rehab processes. So I know there's a cliche about how many ounces it takes of cure or prevention to not to have a pound of cure later, but so much of what we do here in our neuromusculoskeletal chiropractic world is preemptive and preventative and maintaining healthy bodies. Our fundamental question is, what does it do to what does it take to maintain healthy people as healthy people? What do we do to keep healthy people healthy? And always into account, we're looking at their musculoskeletal health and how can we get the neurology involved to maintain or improve it. So with that in mind, you'll notice that I'm not sitting today. I'm trying to be one of those do as I do and not just as I say people. And I'm standing here giving my presentation at a table that's too small to be a desk, but we can do a little bit of writing here if need be. So I'm a big fan of the sit-stand desk, meaning that you have a desk that's on hydraulics or on pistons. It raises up to be the right height that you can just stand here and do your computer work. You can do your writing. You can be perfectly comfortable at a standing desk. So look into that. If you're designing your own home workstation, once again, I get some of my best ideas as I rip them off from my patients. But I have somebody who got construction cinder blocks, stacked them up to the right height for himself, put some wood down, and there he has his own homemade sit-stand desk with some very cheap equipment. I know the price of lumber has gone up, but when you consider the how little it takes, and when you consider how much good it does, and you consider that he works for himself and didn't have a company who could buy him his desk and he made his own, kudos, my friend. And there's something that everybody else can benefit from too. So if you're not at a sit-stand desk, make sure that you have a good ergonomic chair. And if you work for a corporation and you might talk to your HR department and see if they have some money in the budget to buy you a good chair, even if you're working from home. You just don't know what you can get until you ask for it. So if we're sitting at a good ergonomic chair, at any chair, and we're not at a standing position when we're working, we want to think about the 90-90-90-90 rule. And that is my feet are flat on the ground. And if this bone represents my shin and this represents my feet, I want to be at 90 degrees here. So my feet are flat and my shins are pointing straight up and down. Then I want to have another 90 degree where my femur bone, that's the bone of my thigh, meets my tibia at my knee. So we have 90 degrees at the ankle, 90 degrees at the knees. And then I want to have another 90 degrees where my torso is going to be perpendicular or 90 degrees to my thigh. And then I want to be able to have my keyboard at a specific height such that I'm going to have 90 degrees at my elbows as I'm typing. So if we can maintain the integrity of those angles, once again, we're putting our antennas in the best possible ergonomic position for maximum efficiency, maximum I'm supporting myself, not straining myself to stay in position. You want to personalize or you want to customize your workspace in a way that suits you. It might be your second bedroom, the workstation might be in your living room, but it's still your office. So if you have any specific artwork that you like, or if you have little personal trinkets or decorative objects or toys that you like to put on your desk, go for it. Remember, this is your workspace. You have to make yourself feel at home in that environment. Somebody told me that they turn their extra bedroom into their office and they live with other people. So when they're working on a project that requires attention to detail, or if they're at a meeting on Zoom or any other internet-based platform, they put a do not disturb sign up on the door. It sounds so simple, and it's such a good idea to ensure that you're going to have some quiet and some privacy and be left alone to be at work. The next important point that comes about is your light source. You want to make sure that your workspace is as well lit as possible to suit your needs. And whether we're talking about natural sunlight or whether we're talking about the lamp, either way, you don't want to have that light source directly in your eyes, nor do you want to have it bouncing off of your monitor. So be conscious of where you put your light, be conscious of where you put your desk, with respect to where the window is and where morning or afternoon or even evening sun may be. So far, so good, Phil. Do we have anybody else tuning in? Or okay. All right. So once again, if you feel like participating in this workshop in some way, shape, or form, and you're welcome to put your comments in the chat box, and we'll certainly do what we can to include you in the adventure. The next point we want to talk about is the monitor height. And this is going to go in concert with that 90-90-90-90 rule that we talked about. And you want to have your monitor, your computer monitor or your television or whatever you're working off of, you want to have it at eye level. If you can't get an ergonomic chair from the HR department at your company, or if you work for yourself and you're responsible for your expenses and it just doesn't fit the budget. One of my patients actually, and I spread this to my chiropractic network, people loved it. One of my patients went to AutoZone and they found a seat cushion that was just particularly comfortable for their body. And instead of putting it on the driver's seat of their car, they put it on the chair that they were using for their office chair. And just like that, they had a very comfortable, supportive, ergonomic seat. They put a pillow to support their lumbar spine, their lower back, and it continues to work out very well. You want to make sure that you have a dedicated workspace. So don't sit at your couch, don't work from your bed, work from a dedicated workspace. If you do meetings on Zoom or any other internet platform, you want to make sure that you speak at every single meeting, even if you're just saying hi and goodbye to everybody. Participate, assert yourself. Somebody else told me how important it was that they maintained a dress code. I know that I've joked around with a lot of people that they say, well, I have a nice background that I sit in front of. So when I'm on a video conference, they see my background and I'm wearing a very professional top, but I'm wearing my pajama bottoms. And that's funny. I mean, if it works for you, it works for you. But I had somebody else told me that when they put on their dress for success clothes, they succeeded and they were so much more productive and they were so much better at their job when they dressed for their job, not just wearing jeans and a t-shirt or whatever was comfortable that day. So that's certainly something to consider. Another thing to consider is to have a multi-pronged power strip and plug all your electrical cords in an efficient way, so you have a handle on where your cords are, where you know where they are, and you're not going to trip all over them if you're walking around your customized workspace or your personal dedicated workspace. Don't trip on your power cords. Another thing that people talked about was how important it was to have a routine, to know that I'm doing whatever it is that I'm doing for a certain amount of time, and then I'm going to take a break for a cup of coffee or a cup of tea, or I'm going to get something to eat, and I just have the same routine every day, knowing that I'm not being directly supervised, but I stay in my routine as if I'm not supposed to get up out of my chair unless I've reached a certain quantity of work done, or until it's time for me to take my described break. As far as staying in the routine goes, one of my favorites, because of what my presentations are really about, because of my own interests and hobbies, because of what I try to get through to people both at these workshops and to my patients when we work one-on-one, is the idea of maybe part of that routine means an exercise break in the middle of the day. Doesn't mean you have to go to the gym. It doesn't mean you need a lot of fancy equipment or expensive equipment at home. It just means you need to get yourself either out of your chair or away from your stand-up desk and get your body moving and not allow yourself to become stiff. So what we talked about with this long in the abdomen, torso rocked back, pelvis is a little bit forward, head is all the way up. Let's get ourselves into that posture again. And now that we're here, what I want everybody to do is squeeze your shoulder blades together behind your back as tight as you can. Just because you can't move your shoulder blades anymore doesn't mean you can't squeeze a little bit harder, and relax. Let's do that again. Big shoulder blade squeeze. Remember, our head is up. It's being suspended by that string coming down from the ceiling to the tallest part of our head. We're squeezing our shoulder blades and relax. Now, this all really starts to blend and flow together. That, from my chiropractic perspective, I treat so many patients who have tight neck musculature. They're tight up here at the top of their chest, and it all comes from they're driving, they're working at the desk, they're eating. It's all the same. They feel themselves collapsed into here, folding their chests in, stretching the muscles of their upper back without creating any kind of strength and stability in that area of their body. And what happens is they start to get headaches, neck pain, and these are all, once again, with the right exercise and the right posture and the right lifestyle, preventable. So what we do is the appropriate muscle release. I like to do a little bit of trigger point work. I do trigger point work while people move through a range of motion. I do some assisted stretching. I adjust the spine. I adjust the extremities. And we literally help people feel loosened up and teach them the very postures that we're talking about right here at this workshop. So let's do this again. Long in the abdomen. We're tall in our torso. Our shoulders are rocked back. We're going to squeeze our shoulder blades together, tightening the musculature that supports and stabilizes the shoulder blades, pulling the front part of our shoulders further and further backwards. As those muscles become stronger, as this becomes stretched and more flexible, we start to eliminate a lot of neck, upper back, and shoulder pain. So here we are, and let's relax this ever so slightly. So our shoulders are still backwards and pointed down. Big deep breath in through your nose. 1,001, 1,002, 1,003, and blow out through your mouth. So here's the drill. We're squeezing tight, relax, deep breath, hold some more, exhale, relax. And we're going to do 2 or 3 of those, maybe every hour that we spend working at hopefully our sit-stand desks. If we're not at the standing desks, then while we're sitting in our ergonomically comfortable chair, whether it's one that our company bought for us or whether it's one that we created with a few pillows and a seat cushion from AutoZone. we were going to stop and take that flexibility, deep breathing break, take you a minute for every hour of work, and you accomplish quite a bit. Okay. So that's the workstation ergonomic section of this talk, and we moved pretty quickly to get through a lot of important concepts because I wanted to make sure that I left time for this as a second part of what can you do for yourself. And this is something that I've talked about at previous workshops that I've kind of let go, but very specific requests from somebody who wanted me to go over this again, and I'm accommodating. I'm trying to be accommodating at least. So what we're going to do is we're going to talk about emotional freedom technique and run through it for a cycle. Roger Callahan was a psychologist who was working with Vietnam combat vets who, this is the 1970s, and that's before the diagnosis of PTSD became official. I mean, I think PTSD is a part of the human condition and has existed since the beginning of time. But to be a recognized medical diagnosis, we didn't get to that point yet. So these guys came home from their combat experience in Vietnam, and they were having a very difficult time reintegrating into society, and they're working in this group therapy session. And Dr. Callahan was not getting anywhere with this group, and Dr. Callahan is one of these people who he reads a lot. He's interested in everything, and how can I learn something in this corner of the world and apply it to a different corner of the world? And he learned about this emotional freedom technique, which comes from acupuncture and acupressure, and it's a self-applied modality. So he tried this with his support group people. And all of a sudden, they started to make some progress and have some breakthroughs. So he ran with it. So what we're going to do is we're going to run through a cycle of emotional freedom technique. And it involves saying a specific mantra. That mantra is going to be individual specific. It's going to be about something that's going on with you that you really wish weren't. And acknowledging that even though you have whatever it is going on with you, you love and accept yourself. So my mantra could be, even though I have this deep-seated anxiety, I deeply love and accept myself, which I think is very appropriate for the time that we're living in. Your mantra could be, even though I have so much difficulty with my putting game, I deeply love and accept myself. Or even though I have this inability to concentrate, I deeply love and accept myself. So there are really a lot of different, anything part of your own personal constitution and your own personal challenges that you're gonna that you have going on that you want to work your way through is appropriate. But we're going to work with this, and we're going to say, even though I have this deep anxiety, I deeply love and accept myself. That's what we're going to work with for the sake of the presentation. But it doesn't mean that that's the only right answer. It might not even be the right answer for some of the people out there, but I think it's universally acceptable. So what we're going to do is this. Once again, lean greens helps with the parched throat. We're going to start with what's called the karate chop place. And I'm going to use the fingers, my right index and my right middle finger to tap. And I'm going to use the fingertips, the surface right here. And I'm going to tap because of the size of my fingers and the specific point that I'm trying to tap on. I'm going to get it right, even accidentally. So we're going to talk about a very gross area. And we know that somewhere within that really gross area, we got it right, and we're on the exact spot that we want to be. So if I'm going to do a karate chop and I'm going to try and break through this board like so, what part of my hands would I want? Where am I going to be my strongest to make this happen? And I'm going to say it's this hard bone right underneath this fleshy point at the base of your pinky finger. So I'm just going to use my right index and middle finger to tap on that fleshy point. And I'm going to say, as I'm tapping, even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. And You can do this. I mean, we did this 3 times just now. You can do it once. You can do it 20 times. It's a little individual specificity. What works for you, you have to find out through trial and error. But I want to make sure that I'm introducing the concept. Then we're going to come up here. When you go to the office, the clinic, and you're going to be measured, and you want to be as tall as you possibly can, and I'm stretching my head up as far as it'll go. And what's the point, the tallest point on my head that it's going to interface with that arm coming out of the scale to measure me? I want to be on that tall point. So I'm going to be tapping once again with my index and middle. And I'm tapping on that point where I'm the tallest. I'm going to say, even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. And from here, we're going to come down to the spot where my eyebrow comes to an end and my bridge of my nose is a little bit middle of closer to the midline than where my eyebrow ends. So I want to split that distance. And there's a little point by the edge of the eyebrow, the beginning of the nose. And I'm going to tap right there. And I'm going to say, even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. And then what we're going to do is we're going to rotate around the eye. That if we want to say in line with the nose is 12 o'clock. 12 o'clock, we're rotating out towards the far edge of our eyebrow. And we're going to find that fleshy spot where the eyebrow ends and the right before the bone, the orbital bone becomes prominent. And we're in that fleshy spot there, tapping. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. And then what we're going to do is rotate down to the bottom of the eye. Once again, there's a fleshy spot underneath the eyeball before the prominence of the bottom part of the orbital bone. And I'm just going to very simply tap right there. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. And from there, we're going to come down the midline and right where the middle of where our mustache might be, there's that indenture underneath the midline of the nostrils, and there's a fleshy spot there, and I'm going to tap. And I'm once again, even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. And from here, we're going to slide directly down below the bottom lip into this fleshy spot above the chin, below the bottom of the lip, right along the midline. And I'm tapping. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. And now we're going to slide lower yet. We're going to come, I'm still, once again, I'm using my right fingers and I'm tapping on the left side of my body. And I'm going to find where my collarbone ends, in the fleshy spot between the end of my collarbone and where my sternum, the middle of my rib cage here, my breastbone might live. So I'm in that fleshy spot. Even though I have deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. And now what I'm going to do from here is I'm going to slide down my midline to the point where that xiphoid process lives. We talked about this as being the top end of the boundary where we're trying to be long and tall in our torso. We're at that same landmark. I found it. And now I'm going to keep sliding over along my rib cage till I find this seam on the midline of my body where my ribs start to jut out. And I'm going to tap right there. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Now from here, we're going to be through with our mantra. And what we're going to do is we're going to move to the lateral aspect of our thumbnail. And what that means is if I put my thumb if I rotate my thumb in such a way that it's in line with my other 4 fingers, I want the aspect of the thumbnail which is further away from my index finger. If we want to have our basic map of the body and we want to find our landmarks, we start in this position. So our palms are facing forward and our arms are out to our sides. And this is called anatomical position. So when you talk about something being lateral or medial, it's starting from this position. So you can see that thumbnail that is away from the index finger. If I'm in anatomical position, it's out to my lateral periphery. So that's where I'm going to start. And I'm just going to tap on that spot. And you know what? Let's continue with our mantra for this. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. And then we're going to move to the lateral aspect of the fingernail on our index finger, which means that we're on the part of the fingernail away from the middle finger. We're going to tap. I'm going to tap. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Now we're going to do the same thing on the lateral aspect of the middle finger. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. We're going to skip the ring finger, and we're going to move to the lateral aspect of the fifth finger, the baby finger. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Even though I have this deep anxiety, I deeply love and accept myself. Now, what we're going to do from here is we're going to find what's called the Gamut Point. And that Gamut Point is between my fifth finger and my ring finger on the anatomical position. This is the front of my hand. This is the back of my hand. So I'm on the back of my hand. I'm in the fleshy musculature in between my ring finger and my fifth finger. And I'm just going to tap. And I'm not going to say anything. I'm just going to stare straight ahead, focused on everything that's in front of me. And I'm going to keep tapping. And what I'm going to do here is I'm going to continue staring straight ahead, but I'm going to shut my eyes. And I'm going to continue tapping and continue tapping and continue tapping. And now what I'm going to do is I'm going to open my eyes and I'm going to look hard and down to my right. As I continue to tap, I continue to tap, I continue to tap. And now I'm going to look hard and down to my left. As I continue to tap, I'm still tapping, I'm tapping again. Now, I'm going to continue to tap and I'm going to roll my eyes clockwise several times. And I'm going to roll my eyes counterclockwise several times. Now I'm going to continue tapping and I'm going to hum the alphabet. And I'm going to continue tapping and I'm going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And we're done. So if I had a crowd full of people who were participating along with me, this is the point where we would talk about, what do you feel? Usually, I mean, I feel right now, I feel a little bit more alert. Not that I was falling asleep on you to begin with. I feel like my energy has been dialed up. I certainly feel like I'm invigorated. And what I like to do is when I'm between patients, if I spend somewhere between 20 minutes and a half an hour for an appointment time. And so it's my work is physically tiring, but we talk. My patients and I talk, and sometimes somebody will occasionally tell me something that's horrific, and it sticks with me. And I don't want to be thinking about that when it's time for me to work with the next patient. So it's very, very common. A very common thing is for me to walk a patient out to the front desk after we finished up, gather up the next patient's chart, and they look at me with that, is it my turn yet? Is it my turn yet? Look. And I give them a sign like, I'll be with you in 2 minutes. And I go to my office and I tap just to sort of recenter myself and refocus myself and not focused on somebody else right now. I'm focused on the next person. So this is actually a very powerful and a very effective technique that you can use and employ and treat yourself with. That this is self-applied treatment. So with that in mind, I guess there are no questions in the margin, no comments, no moral outrages, nothing. So I want to thank everybody who's been involved with me here, paying attention and indulging me on this workshop. I certainly want to thank Phil for all his help monitoring the technology. And I'm appreciative of having the chance to be able to make these presentations here at the World of Wellness. I'm appreciative that nobody was hypercritical of my new Thai audition to see is this going to become one of the favorites. Long-standing, long-running joke if you're just tuning in now. Okay. Sam D'Alessandro commented it was good. Thank you, Sam. Thank you for paying attention and indulging me and making yourself a part of it. And I also want to thank Sarah Shook for shaving all of that unnecessary heavy-weighted hair off my head so I can be free and easy talking to you guys today. Thank you all so much. And on to the next presentation. Actually, I'm not going away yet, but on to the next presentation. Am I done? I'm gonna be part of.
Yeah.
Yeah, at least for the first half hour before.
It's still live? Is it good?
Okay, so we're still live. That's
I want to thank Dr. O. Actually, I was in the back tapping.
nice.
So
nice.
And now I'm all refreshed from tapping. I was listening and tapping back there. Dr. O has always got something unique for us. So the next presentation at noon, our roundtable. I still don't know who's all joining us. We might get somebody from over at Trinity at the conference. We might get Tracy, but Dr. O is going to join us for the first half, and we're going to do some questions or some statements that start with "my doctor said," and I think we'll have some fun with it.
Yes.
All right, we'll be back in a few.